All right, welcome to today's Virtually O'Neill event with O'Neill IUPUI Professor Peter Federman and current student Sienna Sorrentino. I'm Neil Blady, Alumni Board Member and past Board President, and we are very glad to have you all here today. A little bit about me, I got my BSPA in Bloomington and my MPA at IUPUI, and I'm currently the legal counsel for Rolls-Royce North America, but even that role as an attorney, I lean back on my experience and my education from O'Neill daily in my career, having spent time in the state government in the O'Bannon-Kernan administration prior to law school, and then with the Department of Defense as an attorney for over 8 years before moving to a defense contractor. So that's a little bit about me, but I want to also welcome all of you, and if there are people interested in participating with the O'Neill Alumni Board, there are opportunities, and I would like to draw your attention to the Mentor Collective. Maybe some of you have been contacted about that, or you could always reach out to the school and to learn more. And there's also opportunities for the Alumni Board. We're always looking for engaged and talented alumni that want to bring their expertise to the board. If you don't have the time personally for those things, and I know we are all crunched for time, we have other initiatives that the Alumni Board is pushing, and always our scholarship. We recently added a 5th scholarship and are on our way to adding a 6th scholarship for O'Neill students. We also have started the O'Neill Future Fund, and this is a unique fund to celebrate our 50th anniversary, which is coming up in 2022. And the goal is to raise $50,000 and by our 100th anniversary to have $1 million to spend on the current needs of the school and directly for students. So enough on that. I'll jump into what our presentation today is about. Professor Federman's current work investigates how administrative officials, particularly elected officials, make decisions within the substantive areas of public health and safety. Sienna is an MPA candidate in public policy analysis and recently received a graduate certificate in environmental policy and sustainability. Since May, Sienna and other graduate students have been assisting Professor Federman and Callie Curley in the coding of executive orders for COVID-19 executive orders dashboard. Today, Peter and Sienna will present their dashboard, which analyzes pandemic-related executive orders adopted at state levels. There will also be an opportunity for Q&A after the presentation, and you can reach out through the audio and through the chat feature. And with that, I will turn it over to our experts. Thank you.
Thank you so much, Neil. Let me know if you can't hear me or can't see something. I'm going to bring up a PowerPoint in just a minute. I'm Professor Peter Federman. I'm an assistant professor here at the O'Neill School. I've been here for, it'll be 2 years in this summer. And my work has focused on public health and safety since before the pandemic, but certainly with the advent of the pandemic, it has become particularly relevant. And so along with an O'Neill colleague who is now at the University of Miami, Callie Curley, I began working on developing a dashboard and a data set to understand what state level officials are doing to combat COVID-19. And that's kind of a broad introduction to what this is. And so I'm going to go ahead and bring up my slides now and kind of walk you through a little bit of what our process of putting this together has been. Okay, and now can you all see my slides?
We sure can. Thanks, Peter.
Fantastic. So this is our COVID-19 Executive Orders Project. I'm Peter Federman, and with me I have Sienna Sorrentino, one of our fantastic graduate assistants. I think at this point we've now employed a total of 8 O'Neill students on this project, and that number will continue to expand. As you will see as I walk us through kind of what we've been doing, this is a very heavy lift data-wise. And so having a crack team of graduate and undergraduate students has been a really important part of this. So what is this dashboard? So we, at the outset of the pandemic, we began seeing that a lot of the initial policies and the initial political responses to the pandemic came from governors and state level officials. There was very little from the federal government in terms of guidance, as you all are aware. And so state governments were really tasked with doing quite a bit of the heavy lift. And given that state legislatures, like all legislatures, are a little unwieldy in terms of getting things done quickly, much of this fell to the executive branch, and in most states, that's the governor. So we pursued a qualitative coding process that utilized an iterative process tracing strategy. And what this means is we quite literally downloaded and read all of the executive orders on COVID-19 from all 50 states, beginning in February of 2020. That then developed into our data set of over 1,700 now, well over that actually. I think we're closing in on, this is a little out of date, we're closing in on close to maybe 2,500 orders from around the country, from governors or from executives that they explicitly gave power to give these orders, like heads of public health departments and similar, over 2 phases, both the initial closures that last from about February through June of last year, and then the reopenings and even potentially some reclosures from that point onward. So what we have right now, and what Sienna is going to show you, is kind of our deliverable from that first part, that first phase, the initial closures. But this project does continue, and we are actively, even as of now, continuing to track these. When I talk about how we coded these orders, I put up here a screenshot of our kind of main coding database. And what we're doing is we're reading through them and we're identifying whether or not certain elements exist within that order, and if so, what they are. You can see from where we've pasted in some text as opposed to just a binary yes or no, this exists. On the left is an example of one of those orders from the state of Indiana, the declaration of a public health emergency, one of the first orders issued here. And we code these orders across over 70 categories. So that's 70 columns of data, 70 different elements that we're capturing of these orders. And all of them are coded by at least 2 individuals to ensure what we refer to as inter-rater reliability, that we're not sort of, missing something, that we're not interpreting too much, that we're sort of sticking to what the facts give us. So this is a screenshot of what Sienna is going to go into more for all of you. It's our actual dashboard, our data repository built out of that spreadsheet that I showed you, along with the help of some fantastic undergrads from the University of Miami. This is where you can go at covid19eos.net. And you can play with our data, and you can do all kinds of things. You can download a sample of it. You can look through what different states do. And again, I'll leave it to Sienna to kind of show you some of that. But this is sort of the big project that our data set built. And this is really cool. And I will explain why, because it isn't just a, academic article, right? It's something that people can use. It's something that, you can show to your family who are not as familiar with public policy as maybe all of us are, and say, hey, here's a way for you to start understanding some of what's going on here. And most importantly, what we do is we create a place where you can be comparative with this stuff. You can look at the differences between Indiana and Ohio, or New York and Texas and North Dakota, right? You can track everything from the smallest changes in tax policy to delays of elections and other sort of really meaningful substantive things that were put in place due to COVID-19. And I would say one of the more interesting things that we found is that a lot of the policies that are put in place are not just about, oh, you got to stay home, or, you have to wear a mask in public. They're about all kinds of other things, and they have a huge impact on the policy environment of a given state, even well beyond just how it impacts COVID-19. And that's kind of been the focus of our first set of findings from this data, is these things that are happening and how they're influencing the broader state governance, not just sort of how they're dealing with the virus. And so I'll run through for you a few of our findings thus far, some that have been published, some that are still in process. First, I'll go over kind of these initial 3 publications. One is a book chapter, 2 are peer-reviewed journal articles, and they really look at, as a whole, starting with this one in State and Local Response to COVID-19, a microcosm of state-local conflict and cooperation. We consider the role of states in dealing with this crisis, right? And how they've dealt with it compared to, for example, local governments, also compared to the federal government. Then in Public Administration Review, we talk a little more about what we actually find in those state orders. And we divide them conceptually into 3 major kind of ideas. We see restrictions. These are, the limitations we place on everyday life. The stay-at-home orders, the wear a mask in public, the, business closures, that kind of thing. Suspensions, which are suspensions of rules intended to make things easier, either for the citizen or sometimes for the government. Things like delays in when your taxes are due, or, an extension on your driver's license so you don't have to go in and renew it, right? Changes to the process of getting a marriage certificate, all kinds of things like that sort of change how we engage with government. And then finally, enforcement. And we actually then go further into that in our article for the Journal of Comparative Policy Analysis, and actually think about the motivations and look at what is being enforced, right? Because we have all of these policies, but they are not enforced equally. They're enforced in different ways by different groups in different places. And it's worth kind of pulling that apart and understanding what those differences really are and how they're being enforced. So beyond that, we're also looking at 3 other kind of distinct projects, but of course there's undoubtedly more to come, again, just from this kind of first initial part of the project. A paper looking at theories of decision-making in crisis, in particular bureaucratic politics and political markets, and how these theoretical understandings of decision-making can help us better understand why states are choosing such markedly different paths towards combating the virus. I'm also working directly with 2 other fantastic grad students on papers out of this work, one on equity and voting and the impact of these orders on electoral access, and another one on executive leadership styles and how leaders in particular, how governors as leaders have been dealing with this crisis. So again, much more to come, but this is sort of the initial projects that we're building out of this. So I also want to talk a little bit about the impact that we've had outside of academia, because that's been one of the really powerful things about this project. And I think one of the great things that, can speak to some of our alums who, are obviously involved in policymaking and in the public sector outside of academia. We've presented our findings to people from and employees of the Indiana Family and Social Services Administration, the Clinical and Translational Sciences Institute for the state of Indiana. And we were also then contacted actually by both the Oklahoma State Department of Health and by the CDC and their pandemic response team to work with them on some data issues and on some understandings of what we're seeing in what they're doing. And so, we began with the state of Oklahoma, and I've put here a chart that we developed for them out of our data, showing them sort of the correlations between the orders in Oklahoma and cases, and also importantly, data on retail and recreational movement from cell phone companies that actually shows if people are going out more or staying in more compared to the week prior. And so working with policymakers like this is incredibly fulfilling. And we're particularly excited, of course, to be working with the CDC and specifically their Office of Health Equity. And I can talk a little more about that if people are curious at the end, what that's beginning to develop into. So we also have a kind of broad plan going forward of what we want to do and where we want to see this project go as we continue to collect these orders to build our data repository, potentially build a second dashboard that goes beyond just the initial closures. We're obviously actively seeking funding opportunities, as everyone always is. We've been successful with some already that I'll talk about. We're focused on also data communication. So things like this dashboard and like having presentations like this with all of you, engaging with policymakers, going on the news and talking about this, something that we've also done, communicating what we're finding. We're also really, really thrilled to engage in mentorship and collaboration with our graduate students. As Sienna is going to talk about, there are a number of students on this project, and they have all served different roles, but they've all been extremely important to how we've been able to kind of take this so quickly to the level that it's at now. And then we also really want to continue partnering with the public sector, including the CDC, to really get this knowledge into the hands of people who can do something with it. In terms of the particular types of papers we're looking at going forward, one thing we're really interested in is continuing to refine how we define and how we lay out stringency and how strict we consider certain measures of restriction as compared to others. That's something that's been lost quite a bit, I think, in the coverage of this, in the media and certainly even in other academic understandings. Stay-at-home orders are not created equal. And certainly, restaurant closures and all of these things, you might see that, these 3 states have closed restaurants, but that means completely different things in terms of the actual stringency. Does it mean that people can still eat outside? Does it mean they can eat inside? Does it mean they can get takeout, right? These nuances are really missing. And so we want to continue to build on that. We're also working on understanding theories of power transfer, why and how governors provide power to, say, health departments to take on, the substantive work of putting out executive orders and enforcing them, because we see that really varies state to state. We're also interested in pursuing ideas of neural networks and text analytics to actually formalize and increase the speed of being able to code these things, right? Right now, we read them all, and that's great, and it's useful, and we'll continue to do that, but it would be great to have some systematic ways of understanding these orders as well. And then finally, in particular with our work with the CDC, we're really focused on enforcement and equity in enforcement in COVID policy. How are these rules around and restrictions being enforced, who's enforcing them, who are they being enforced on, and are there inequities present in those relationships? So that's something we're really excited to continue to work on as well. We have been pretty successful thus far in receiving several awards and funding for this project. First, we always have to thank the Indiana University Vice President for Research Office and the O'Neill School that provided us with an initial grant to get this off the ground. They've been incredibly supportive and promoted this far and wide. And so the O'Neill folks and the folks at IU Research in Bloomington have just been incredibly supportive, and we're really thankful to have them behind us. We also received an award, the annual Voinovich Public Innovation Challenge Award. It's co-sponsored by Ohio University and by NASPA, the accreditation body for public service education. And it's named after the Voinovich School and George Voinovich, the former senator from Ohio. And we presented our work on the dashboard at the NASPA annual conference and received a very substantive financial award, and really just a fantastic partnership now with both the Voinovich School and with NASPA to continue to keep them up to date on what we're doing. We have several other awards kind of under review at the moment, and we're hopeful that we will get a larger grant to continue this work on beyond just the next year or so. And finally, we've received quite a bit of media coverage on this dashboard, and we've been proactive in searching it out. And we've been thankful to the O'Neill School and their staff as well for kind of pushing press releases on this out to people in the community, because we think this is important information and we want people to visit our dashboard. We want them to understand this stuff better. And so, you know, we've interviewed with the Indianapolis Star and the Chicago Tribune. IU Research sent out a press release far and wide, and we've appeared on WGN in Chicago, WRTV here, and also WFYI, NPR radio here in Indianapolis. And we want to continue to spread the word. And so we also have a hashtag here that we use on social media when we're posting about our dashboard or about our newest findings. And we really encourage you to follow what's going on with this work, because we're really excited. It's going to continue. We don't see this slowing down. In fact, if anything, we're really just ramping things up. We brought on 2 new grad assistants, and we are continuing full steam ahead this semester and hope to have more to share with you soon. And so with that, I'm going to turn it over to Sienna to shift gears a little bit and actually walk you through a little bit of this dashboard that I've talked about, this kind of big first initial public deliverable out of our project. And I will go ahead and stop sharing and allow her to share her screen for you.
All right, thank you, Dr. Federman. Let me pull up my screen. Can everybody see our dashboard, I believe?
Yep.
Yes. All right. So I'm going to be going in a little bit more of how to actually use the dashboard, which is honestly kind of fun for me to use. I've been working on the user guide for the dashboard to kind of help on the general public can easily visualize the nuances and the stringency of these restrictions. So this big screen right here kind of shows visually where the stringencies are more strict in each state. And you can scroll on this bar to go throughout time. So we begin in March 1st, I believe, to June 13th, which is when states began to reopen. So if you click on this, you can kind of see as more states pass executive orders. It was like a day-by-day thing. As we were recording these executive orders, you could every single day, we would log into each of our assigned states and see more executive orders were passed, detailing different restrictions and suspensions, as well as enforcement measures. And if you go a little bit faster, you can kind of see some states began to close, and that's when we stopped writing down data for those and coding those executive orders until the very end. So this is just for the first wave. Some states began again closing up, so there will be hopefully a new dashboard in order to record those. So I really appreciate the visualization of that, and that can kind of help the average person understand the restrictions placed on normal daily life as the state governments kind of responded to the pandemic as quick as they could. So that is one of the visualizations of this. In order to actually download the data, which would be important for the instructors and scholars and those who are wanting to conduct research with this data, you can actually select various variables. So you can sort them by state and by the official who issued the executive order, which is one important thing that we realized as we were coding this information is different states delegated different powers to different officials. And that's also an important way to understand how this executive branch of each state works. So any demographic from citizens and students to scholars and public officials can utilize this visualized database from this public-facing dashboard. And on this side, you can see the cumulative the COVID-19 cases over time to kind of have a visualized comparison of when these states passed specific orders and how that actually may have impacted what the COVID-19 cases were. But this is just kind of like a visual indicator of this is where we were at when we passed this executive order. So going into specifics, where the specific states were, I'm going to pull up Indiana. So we have this guide up here that can scroll down to each individual, all of the 50 states. So here's Indiana. So a different dashboard pulls up when you zoom into a state. And this is where it kind of gets more complex, but many different multidisciplinary scholars can use this information for various ways. But the visualization up here, so this is the total COVID-19 cases for that state. The next module is the stringency of restrictions in a linear format as time goes on. So this is just the generalized stringency of restrictions, but this module allows more specification as you look at this. So they're divided in a few different columns. So there's education, medical, recreation, restaurants, stay home, travel. So this goes into more detail of how this affected everyday life, while the suspensions information details the policies that are put in place for businesses and permits for individual people. So the suspensions are the modification in policy. So we went into detail. So a lot of states issued nuances according to the sale of alcohol and marijuana, which was interesting to see each state's priorities. So I like to look at this as kind of like a showcase of what the state prioritizes as its industry. So one of my states that I actually coded was the state of Alaska. And I thought it was so funny. They prioritized, they deemed bingo halls an essential business. So that was one little interesting tidbit of information. Each state has their own little interesting prioritizations that are listed in these executive orders, and it shows a lot of how the state actually works. On this side, you can see some of the basic state information, such as like state party affiliation, the governor information, which from the centralized leadership, he is the one or she is the one who would delegate to each agency the ability to issue these executive orders. Up here, the state demographics are contrasted to the US demographics, so you can see how the state fares against the country as a whole. So a condensed interpretation of these executive orders would allow governments to more securely determine the effects of their implementation strategy, as you can see by comparing this line graph to the total COVID-19 cases. So these policies that have been implemented in response to the pandemic are a lot, although the intention of these policies is to mitigate future cases and lessen total impact, we can really see how these executive governments function. So in the user guide, we actually talk about the different perspectives that can use this database. So business owners and citizens and employees can really utilize the nuances in the stringency in order to see how each state preserves their movement of social mobility. So individual freedoms and businesses alike have been directly impacted by these government-directed policy changes, and the governance of states changed very much in such a short amount of time. So by looking at these individual state dashboards, especially in the stringencies of restrictions, businesses can evaluate the past state decisions based on their industry. So we have recreation decisions right here. You can see the different executive orders that deal with the recreation aspect. You can look at how restaurants changed out throughout time and when they started to reopen. And when you look at the date of that change, over here you actually have the links to the exact executive orders that we downloaded in red, so you can read yourself and see how we understood that executive order to be. So May 1st, you can view this executive order, and this pulls up as the exact PDF of this executive order where we read and coded each aspect, so it doesn't just apply to restaurants. There could also be different aspects talked about and coded in from that executive order. So another important aspect for the everyday person would also be education and how their children's education changed throughout time, as well as gathering bans in each individual state. Personally, for me, coding this as time went on, it was interesting to me. I had friends in other states and I was talking to them about how these different gathering bans impacted them and where they worked. And it was interesting to see how these were enforced in each state. I had a friend in Michigan who was very opinionated about how their states enforced their gathering bans. But it was very interesting to see the differences in each state and how they responded to the public health crisis. Moving on to another perspective that could use this dashboard, so students and instructors from universities can learn lessons from these mandates and how they are communicated to the public. So this dashboard can be used by students of any level to better understand policy diffusions, the tensions between the political and administrative actors, the intergovernmental relations, as well as emergency management at the state level. So students can utilize the skills that are facilitated in their policy classes, and this gives them the opportunity to apply themselves to real world experiences. So like paying attention to these differences and analyzing why these differences may be there will ultimately help students compare each state's different approach. So in the perspective of a researcher, this database provides an important opportunity for collaboration, innovation, and connections between students and scholars around this timely and critical issue as time goes on. So not only could this information be used as a part of research that visualizes state responses to pandemics, this can also visualize how the state government works as a whole. So using these primary sources and these selected variables that are able to be downloaded, they can be exported to other avenues of analysis to scholars. So political scientists may be interested in the state party affiliation, and sociologists and economics may find useful the comparative state and US demographics modules alongside the changes in policy relationships. And as I mentioned before, the delegation of power from the state to either county or other local level governments demonstrates how these state governments perform during crisis, not exactly what these state governments say they are doing on paper, but this is how they perform and this is how they act when they are needed. And so future research on these restrictions may also help understand those implications. So local health officials and policymakers and public officials understand that COVID-19 is a policy problem that requires policy solutions. So this causality is important to understanding what is and what is not working. So some sources of variation in these, in-state orders are those which officials have the role to play in the implementation of orders in terms of enforcement. So public officials need to understand why and how certain policies are prioritized over others, which these different nuances allow the visualization of that and what it means for COVID-19 as well as democracy. So this dashboard is intended to be a tool for public officials and allows them to see how their state responses compares to others and also to track that implementation. Healthcare constituents may also find this dashboard useful in order to develop healthcare contingency plans to prepare these systems for potential increases of infection. So under the medical suspensions and the medical restrictions, this may be very important to healthcare constituents. So these cover policy regarding subjects such as telehealth, pharmaceutical regulation, medical records, and COVID-19 testing. So these constituents can look at these procedures deemed as essential most often and try to set appointments accordingly. And in regards to visitations, they may also see which states have more efficient visitation policies for keeping in touch with loved ones and residential healthcare facilities should they contract an illness and implement guidelines as necessary. So this allows kind of like a best practices for each state. And as vaccines are rolled out nationwide, administration may be able to look at how different states make changes in licensing policy to ensure efficient vaccines availability as time goes on and as we continue to track the changes and nuances in these executive orders. So as we go on, there may be different columns and different aspects of this information that we will want to be paying attention to, and more that will become a focus in the executive branch's eyes. So that is kind of an overview of how this database works. Going more into detail of how this has been able to allow a collaborative viewpoint between students and scholars. I was personally affected by COVID-19, as everyone was, but it impacted me. I lost my very first full-time job while I was in graduate school, and I was in Dr. Callie Curley's policy analysis class, and she mentioned to us this executive orders, like coding executive orders, and I wasn't really sure what that meant, but at the time I was just looking for anything to do, looking for something to alleviate the helplessness that I was feeling in regards to COVID-19, as I'm sure everyone was feeling at the time. And I'm very grateful for this opportunity to have a more in-depth and more personal look at how the pandemic has affected democracy as a whole, and it allowed me to pinpoint where I wanted my own focus to be in my research and my work, and allowed me to also secure a graduate assistantship later on with this experience, as well as move on to other research opportunities. So I'm very grateful to have been a part of this project, and thank you so much for listening to me go into detail about this. I hope this was helpful.
All right. Thank you so much, Sienna. I hope you all have enjoyed hearing a little bit about this project. I think we'll be open to taking some questions now if folks have them. I'm also going to go ahead and just put a link in the chat to the dashboard itself in case that is of interest. But yeah, please. I don't know how you want to facilitate the questions, Michelle or Emily, but however you want to, we will go ahead and take them.
Sure. Folks who have questions are welcome to drop them in the chat or to unmute and ask away, and we will relay anything that gets dropped in the chat. So Peter and Sienna, you don't need to worry about looking in there. But if we have questions, go ahead.
Sienna, thank you so much for sharing your story. That's a bonus for all of us to hear about the impact this opportunity has had on you. And Dr. Federman, thank you for thinking about how you can incorporate students into this research idea that came about and give real experience in terms of the opportunity, but paid experience in terms of the opportunity. I think that's so important. So thank you both for sharing that.
Absolutely. Yeah, it's been a pleasure to work with Sienna and with all of our graduate assistants who have just been a really really interesting and thoughtful group of people who all have contributed to the project in ways beyond just kind of, you know, doing the legwork. They've contributed intellectual, substantive evidence to what we're doing. Some of them are co-authors on papers or will be co-authors on papers. Sienna mentioned she just wrote a blog post for a widely read policy blog all about these executive orders, this project, and the dashboard. So yeah, engaging students is a fundamental part of what this is about, particularly given that many students are searching for work and looking to supplement income from home. And this is something that we're able to help out with. So we're happy to and so glad we get to.
In a way, this project allowed me to actually find what I wanted my focus to be on, and I'm very grateful for that. A lot of people lost a lot during this pandemic and continue to lose things, but I'm very happy to say that this project has alleviated that sense of loss.
I'm just curious, Sienna, what are you using to create the like user guide?
Oh,
for the public?
I just wrote it on Microsoft Word.
Gotcha.
and sent it in.
Yeah. We work a lot with ArcGIS online and stuff. I'm
yeah.
at Data Driven Detroit, and we do a lot of public facing data work, but they actually have a platform called the Story Map, and it allows you to kind of do a scrolling tutorial where you can kind of point out and highlight different actual parts of the dashboard in a more interactive fashion that kind of lays out the data and what people should take away from it a little bit. We found it a lot more helpful than just trying to like give somebody a PDF. Then so that might be something to look into in terms of giving kind of packaging flashiness, people are like cool widgets kind of a thing. It might help.
Can you say the name of it again? It sounds very interesting.
Yeah, I'm very interested.
It's a story map.
Story map.
If you want,
oh, go ahead.
I'll drop my email in the chat, and you guys can reach out, and I can send you one of our recent ones. I've been doing a lot. I don't think I have anything COVID related in the story map, but I've been doing a lot of our coronavirus data research for the state and city of Detroit. But I can show you kind of what is there. And then if you see something in our blogs, if you go, there's a tag. You'll see kind of like the different things that I've already written about. If you see somewhere where you think that there might be overlap between your work and what I've already written, I'd be happy to talk about finding a way to like co-author a blog or something to get your dashboard out into our world. So
wonderful. Thank you so much. I think, you know, one of the things is myself and Sienna and the rest of our team, we actually are not ArcGIS experts. We contracted out and used some of the funding that we got to contract with a couple of design experts from the University of Miami who built the GIS portion of this. So, you know, when it came to kind of describing what it is, it's like, well, we don't really have the skills to get into the back end and do that. So I would love to see this, and I'll certainly shoot you an email afterwards. Thank you.
Yeah, thank you so much.
I am also not an ArcGIS person, but I have colleagues that are, so yeah. I learned from them.
Wonderful.
I'll just say, I think this is fascinating information that you've put together. And personally, being counsel for a large multinational with facilities in many states, we've had to sort of react to the executive orders that are popping up in the various states where we have facilities, and understand how that impacts our employees and the ones that can come to work and whether they're essential or not. So I think there's a lot of really good information here that will foster academic research going forward. Has there been much thought on how to, I guess, get this to a broader audience, policymakers, industry that could, use this tool possibly?
Yeah, so we have, like I mentioned, we've collaborated with the state of Oklahoma. We're actively working with the CDC, and in particular their pandemic response team that is based out of NIOSH, which is the industry focused portion of the CDC looking at the workplace. And so we are, and then obviously we're doing everything we can to, go on the news and, post the link to the dashboard everywhere. And yeah, we're doing our best to, with the limited resources we have to reach out and make sure folks are aware of this. I think the best, this way of collecting data and coding it serves mostly, I think, important purpose to highlight that there is a lot more here, even just beyond what we've done. I think, this is really just, it's not a, definitive repository of every policy or anything, but what it does is it highlights to, say, somebody like you who's working for a multinational with, multiple factories and offices and everything, that, hey, this is complicated. This is not an across the board kind of thing. And you need to be thinking about what we're seeing in different states and how that might change your strategy, your, business strategy going forward even. So it's definitely something we're really interested in doing, and we're doing our best to look for opportunities to push it out there.
Great, thank you.
So Neil, I think Dr. Federman is saying forward the link on and his email, and he'd be happy to keep the conversation going.
Yes,
Sure.
Absolutely. I'm always happy to chat about this and connect folks with the relevant kind of resources that we have around these issues. So
Yeah, I mean, maybe for our next alumni newsletter or email, this information is so relevant and so on point, and unfortunately this isn't going anywhere anytime soon. We're going to be living with this at least for the near to hopefully medium term future, not forever. There's light at the end of the tunnel, but the immediate impact is there, plus the long term opportunity to analyze, even just not so much the COVID executive orders, but just executive orders in general. I know there's state legislators are starting to look at, their executive branch and whether it has too much power to issue these executive orders, right? So there's going to be, I think. Yes.
Yeah, no, and I think, when I was talking about kind of like how our focus, at least in these first round of publications, has been, I don't want to say not on the pandemic, but really it's been more about that, right? About executive orders as a policy tool and the kind of, really significant changes that can be made through them, particularly after granting emergency powers to a governor, which a governor grants themselves. And certainly I think, I don't imagine any of us wouldn't classify this as an emergency, but yeah, there's quite a lot to think about here when we consider the implications of things like delaying elections, which did happen quite a bit. The importance of access to, or rather let me phrase it differently, how quickly we saw we could improve access to things like food stamps and rental assistance that had been incredibly difficult to access just 2 weeks prior. And all of a sudden there's a pandemic, and wouldn't you know it, it's really easy to get food stamps now. Well, why is that? And why can't it always be that easy? And what is it about managing a crisis or issuing executive orders that, what can we learn from that about, cutting through some of these things that are often difficult? So there is a lot to learn, and only a very small portion of it is about the pandemic itself, partially also because we just don't have great data on cases and infection rates and hospital beds and all these metrics that would be really helpful in determining what policies are best at combating the virus, which is, of course, the thing that people always ask us, right? Whenever we've gone on the news or talked to a reporter, they ask us, well, what's working and what's not? And we kind of tell them what you're saying, Neil, which is that, well, it's not so much about that. It's much more about, executive power and all of this, because unfortunately, we can't really determine those things. And quite frankly, we may never. And that's part of that is a failure on the part of government at multiple levels. But part of it is just also the nature of a crisis like this. It's been a long time since we've had a kind of malleable sort of crisis like this, where you don't quite know. We know we're missing people who have been sick, right? And that we're missing deaths and everything. And I mean, that doesn't happen with a terrorist attack or with a hurricane even, or things like that. And so it's just a very different situation, and the things we can learn are very different. And so I really appreciate you noticing that, because that makes our job easier, because we don't have to explain why we're studying X and not Y.
See, I told you I learned something from my time at O'Neill.
You did.
All right. Well, I just want to say thank you. Thank you to you both. This was really, really interesting. I'm sure everyone else on the call felt the same. I'm seeing a lot of good stuff in the chat, and thank you for your time. Thanks for everyone for being here, and I hope you have a good rest of your Tuesday.
Thank you, everybody, and feel free to reach out. My information is on the O'Neill webpage, and I'm always happy to connect with folks who are alumni or staff or whatever. So please, anytime. Take care. Thanks for having us.
Thank you so much.